One thing, like you guys all had different ways you asked about immunizations, but
we had a unique opportunity because it was working with hearing impaired patients. So for me, it was very a unique experience, just seeing what goes into helping a hearing impaired patient.
Vaccination history. Are you up to date on everything? And do you get a flu shot every year?
I used to get the flu shot, but somehow or another, I missed it or something. And I seem to do all right.
I went through like the prescriptions and any problems he was having. The nurses were more checking for vital signs. We also had a physical therapist making sure that everything was fine with his feet and that he was able to stand on his own without falling. I think that the most important part of the interprofessional experience is actually getting to see that there's more than just like a doctor, a nurse, a pharmacist. There's the auditory therapist, there's physical therapist. Now even here on the USC campus, we have the physician's assistant.
I know you had already spoken about the vaccination. Has he gotten the flu shot at all?
Getting all of those professions working together to help patients, and when you get that while you're in school, so the stakes are lower and you're able to have mentors there with you, directing you. So this is the perfect time to get to work together, and it also brings a new respect to each profession, getting to work together and see what everybody does.
Yeah.
Hear it?
No matter what, every student at the IPE will have patients that require a variety of services. So first and foremost, we need to understand the importance of communicating with and learning from other health science professionals that will ultimately contribute to our patients' overall health.
Would he say bye-bye when waving goodbye without being prompted?
Si dice adios.
The IPE is just a unique experience overall. I don't know of many other programs that promote such teamwork and unity. And I mean, ultimately, we're all on the same team. We are a team. And in order for our patient to be successful and reach goals across multiple services, we have to, number one, communicate with one another, and number two, respect the information being shared by other team members.
You should keep your tetanus shot up to date. Just in
Really?
case you fall or cut yourself. So you should get that every 7 to 10
You want me to go
years.
down there and get a tetanus shot for nothing?
Well, it's not for anything. But yeah, you should have one of those about every 7 to 10 years.
Yeah, okay.
Yeah.
Okay.
And then there's also the meningitis vaccination.
I appreciated the actual experience of working with real patients. We're fortunate enough to be affiliated with a large learning hospital within our community and have many resources at hand to implement.
Experiences like the interprofessional practice experience are wonderful, and most places don't have that option and ability, and this summer I learned so much.
So, just some of those things that people don't understand, the pressures you're put under, and it's unbelievable, really.
The family was really receptive to the work that we were doing and really opened up and spoke with us, and we found out a wealth of knowledge, how nursing and the medical staff could get involved as well, which was really, really enlightening to see all the different organizations and professions that could really assist this family.
Through those new perspectives that you learn, you're able to individualize your treatment to fit that specific patient, or you're able to refer them to another health science professional who can help them in ways that are beyond your scope of practice.
I work in a hospital setting, and it enables me to really advocate for my patients, where I can see and talk to the psychiatrists, to the nurses, and several different professions to enhance the care of my patients.
It's going to be like it is in the real world. For a pharmacist, if you're in a community setting, being able to reach out to those professionals when needed, for me, just knowing who does what and where to point them to was just vital.